Should I take antiviral medication for the flu? When you catch the flu, it can feel like a sudden wave of fatigue, fever, cough, and body aches. But should you reach for antiviral medications? The answer depends on several important factors. Antiviral drugs are prescription medicines designed to target the influenza virus directly. They work by stopping the virus from multiplying in your body, which can help lessen the severity and shorten the duration of your illness. They can also reduce the risk of serious complications like pneumonia or hospitalization. However, these medications are most effective when taken early, ideally within the first 2 days after symptoms start. Starting treatment later might still help in some cases, especially if symptoms worsen or if you are at higher risk for complications. The main antiviral options approved for flu treatment include oseltamivir, which is taken by mouth twice daily for about 5 days, zanamivir, an inhaled medication, peramivir, given as a single intravenous dose, and baloxavir marboxil, a single-dose pill. The choice of medication depends on your age, health status, and specific circumstances. For example, oseltamivir is often recommended for children and adults, while zanamivir might not be suitable for people with breathing problems like asthma. Baloxavir is generally well tolerated but is not recommended during pregnancy or breastfeeding due to limited safety data. If you are in a high-risk group, such as young children, older adults, pregnant women, or those with chronic health conditions like asthma, diabetes, or heart disease, prompt consultation with your healthcare provider is crucial. They can determine if antiviral treatment is appropriate for you. Even if you are not in a high-risk group, severe or worsening symptoms might warrant antiviral use. Sometimes, people who live with or care for vulnerable individuals may also be advised to consider antivirals to help prevent spreading the virus. It is important to remember that antiviral medications are not a substitute for vaccination. The flu vaccine remains the most effective way to prevent infection and its complications. Antivirals are used as a treatment after infection occurs or, in some cases, as a preventive measure if you have been exposed to the virus and are at high risk of severe illness. Always seek medical advice if you suspect you have the flu, especially if you belong to a high-risk group. Do not try to self-treat with antivirals without professional guidance, as they requiring a prescription and proper medical supervision. While antivirals can be helpful, they are just one part of managing the flu. Rest, hydration, and good hygiene are also essential. Remember, the decision to take antiviral medication should be made in consultation with your healthcare provider, who can assess your individual health needs and guide you on the best course of action.